Leven in de oplossing. Sommige mensen kampen met problemen waar ze zelf de oplossing niet meer voor kunnen vinden. Een internationaal behandelcentrum kan mensen hierbij helpen. Wij zijn afgereisd naar VillaRamadas in Portugal, waar ze verschillende behandelmethodes aanbieden voor diverse problemen. Filipa Oliveira vertelt ons als eerste waar zij mee kunnen helpen.
A treatment center like ourselves, we deal with a lot of persons that come to us with problems regarding the work, with OCD, depression, burnout, and we also help people dealing with the addiction patterns like drug substances or alcohol abuse. We also focus on the individual itself and not in the destructive behavior, and we help with depression and burnout. We hear a lot about burnout nowadays due to all the rising pressure that we might feel at our job. Burnout is characterized by the extreme exhaustion, the lack of interest, the powerlessness that you feel regarding your job, and you can develop disorder if you don't have any outside activities to release your frustration, if you keep feeling that you don't change anything at your job, and if you don't take care of yourself. The main issue with burnout is that it can develop depression. Burnout is more focused at your work, in your job, and depression is when the whole sadness that you feel takes over your whole life. This way, depression is characterized by the main sadness that you feel, the lack of energy to do the things that you usually do with pleasure. It can be developed towards some months and years sometimes, and the depression can develop a lack of motivation and purpose. We have different kinds of addictions. We have chemical ones, that is where we look at legal and illegal substances as well as alcohol. We also have emotional ones, that is the burnout and depression, and we also have behavioral ones, that is the eating disorders and shopping disorders or gambling. Addiction is when one of these patterns becomes a negative one in your life and you have consequences due to that. Normally people search for our treatment when they can solve the problems by their own, or when the last treatment didn't work out. Also, people search for our treatment when they have consequences in their relationships or their jobs.
Such problems can be treated by some established methods. In treatment, people have no contact with the outside world, so they are already focused on themselves. They also have a group therapy combined with the individual one for them to can share experiences, to know that they are not alone, and also to get identifications, which is much important. So since we are a treatment center, we can use our own literature, which is also developed with the help of the patients because they work on that every day from the assignments we usually give to them. It is something that we usually decide as a therapeutical team because they always have different needs. The purpose of this kind of treatment for the individuals is that they are allowed to work on themselves again, working on the self-esteem and develop again the trust in the others, in the family, in their jobs, because sometimes they come and they lose a lot of stuff, not just in a family way, but also in a professional way. And by working on themselves, they can be more prepared to face the world then again when they are outside. Of course, we always reinforce that trust will take a little time again to be reconquered, but then they can have a reintegration in society. It also allows them to return to their own lives and to be more productive in their jobs.
Aftercare is as important as the residential treatment. We offer an option after the treatment in a residential setting prior the patient returns home. After the return home, we have the online aftercare, the presential in the Netherlands, and the mixture of both. Family is also important in the recovery process of the patients, and family conferences and family therapy, it is required along the processes.
Het is een intensief traject waar veel bij komt kijken. Straks zullen we hier dieper op ingaan. Het Portugese behandelcentrum waar wij op bezoek zijn is in 2001 opgericht door Eduardo Ramadas da Silva, klinisch psycholoog en counselor. Hij begon zijn carrière in de richting persoonlijke ontwikkeling in het Verenigd Koninkrijk, waar hij CEO was van een bekend behandelcentrum. Momenteel voltooit hij zijn doctoraat en onderzoekt hij het gebruik van technologie voor terugvalpreventie. Hij vertelt ons hier meer over.
During the last 20 years, I have learned with my clients and with addictions that even that they are in the most vulnerable moment of his lives to change, they are willing to follow the suggestions of the psychologist and of the team. They are willing to help each other in the very safe environment. And somehow they can change the pain and the suffering with the happiness and the freedom. They start learning to enjoy and to be happy in the treatment. They became having the first experience with his fellow addicts and with the staff, and they can also discover that it is good to be with themselves. For the first time in the treatment, they became to realize that they are not bad persons, that they have passed horrible moments during a few years, but they have a new opportunity for the future. So they go learn, and they learn that they can change completely the directions of the life. The past, it doesn't determine what they are in the future. I have started a treatment center after passing experience myself. Unfortunately, 25 years ago, I have passed through a time in my life of depressions, which I have considered the worst possibilities for my life. Thanks God and thanks to me, I have the courage to don't follow that kind of thoughts, and I have go to a treatment abroad, which was only specific for alcohol and drugs. There, I have realized that it was the need to develop a specific model to help persons with depressions, to help persons in the personal development. And so during the last 20 years, I have developed a therapeutic model.
Mensen over de hele wereld komen naar het behandelcentrum om te werken aan zichzelf. Wie zijn deze mensen en waarom reizen ze af naar dit soort centra?
The type of people that we have coming to an international treatment centre here, primarily anyone who wants total anonymity for their treatment process. And this may be because they're high-profile individuals in business or in the area of media and entertainment. So clients come to us for total anonymity to deal with issues such as addiction, burnout, depression, all forms of eating disorders, OCD and trauma. And they need to come to somewhere that is outside of their normal everyday environment in order to cut the ties with the families and the environment that may be causing them damage. The facilities that we have in our 5 boutique clinics in Portugal are really offering what Portugal has to offer. So we have clinics in the countryside and clinics close to the coast. They all offer similar facilities insofar as they have private bedrooms or with ensuite bathrooms. And then they have the treatment areas where the clients will pass most of their day doing treatment in one-to-one sessions and in group therapy. And then at the end of the day, we have the facilities for the personal trainers, for the swimming, and of course, we're close to beaches and beautiful countryside. So the weekends, we normally have visits to local sites and to beaches.
Het is alweer tijd om er even tussenuit te gaan. We zijn over een paar minuten weer bij je terug. Eduardo zal dan meer vertellen over de door hem ontwikkelde behandelmethode. Tot straks.